Hello and welcome to another episode of Sonya Maya's Psychology. This is a channel where we talk a lot about relationships, psychology, SMEGS education. So if you like that kind of thing, make sure to hit that like, subscribe, and turn on the bell notification so you don't miss an episode. I'm going to be posting weekly again. And if you don't know me, I am Dr. Sonya Maya, a certified sex therapist with a passion to talk about taboo subjects such as peen and vajayjay. And yeah, I wish I could just say the words, but I have a passion to help you make more pleasurable decisions and decisions, and I love puns. So today I want to talk about what it's like to have sex if you have ADHD. A lot of individuals are diagnosed with ADHD. I work with that population, and there can be a lot of struggles that come up. So I want to talk about some of those things, normalize them a bit, and talk about some considerations if you are an individual who has ADHD and you're sexually active or you want to be. Hi there, Spermia here. Get it? Sperm plus Sonya. Yeah, you get it. So by the way, if you want to skip right to the part where Dr. Sonya Maya talks about SMEGS, then skip to 5 minutes in because she's going to talk about some clinical ADHD related things first. So there are some time cards below, so you don't have to worry about the timing, you know, she put that in there for you. So if you want to skip right ahead to the point where we talk about the spicy bedtime stuff, then just skip ahead to minute 5. Okay, thank you, goodbye. Being neurodivergent can really impact our relationships and our intimacy. And if you don't know what neurodivergence means, there's a whole umbrella of disorders that are qualified as neurodivergent. And here's some examples on the screen right here. ADHD being one of the common ones. By the way, being neurodivergent means that you have a disorder that impacts the way that your brain works. I've heard people refer to it as neurospicy in the past, individuals who have neurodivergence. So you let me know below if you like that term. I have heard people say it on social media. It's one of those things that's going around. So if you like neurospicy, let me know. If it's offensive for any reason, then also let me know below because I have a strong fear of offending people.
Thank you, fear.
So I just want to make sure I'm not saying anything that is definitely not like a clinical term, but neurospicy is something that I have picked up on. So being neurodivergent, you might have some strengths and some challenges associated with your diagnosis. And it's not a one size fits all, so it really depends on the diagnosis. It could be helpful to look at DSM criteria to figure out if you resonate with that. But in general, it's really important that we don't diagnose ourselves just by scrolling on social media. There's a lot of posts out there that'll be like, put a finger down if you relate to this. So we can't diagnose ourselves that way, but in some ways it can be good to open the door to curiosity and find out. So in order to get diagnosed with ADHD, you go to a therapist, but there's also assessments for that. So if you want to get officially diagnosed, it's good to do the whole assessment, something that I did in my doctorate program, but I won't get into that too much. But going to a therapist can help you understand and maybe rule out some things and understand if you are neurodivergent or if you know that you have ADHD, some ways to treat and handle that. So overall with ADHD, it is attention deficit hyperactivity disorder. So it tends to impact one's executive function. It can lead to impulsivity, hyperactivity. It could also lead to forgetfulness, having a hard time actually processing the information that you are trying to learn or remember. So not remembering things is super common. Concentration and focus, emotion regulation can be really tricky as well for people who have ADHD. In terms of the DSM-5, which is the Diagnostic Manual for Disorders, there are criteria that you need to meet in order to be diagnosed with ADHD, and this looks different for kids and adults. So for example, in order to be a child with ADHD, you need to meet the criteria before the age of 12, and you meet 6 inattention symptoms and 6 hyperactive symptoms. And for adults, when we're talking about 17 or older with this particular diagnosis, then you meet 5 criteria for attention issues and 5 criteria for the hyperactivity, impulsivity. And for both of those, adults and children, the symptoms need to persist for at least 6 months, and they also need to be relevant in at least 2 settings. We specify typically clinically if someone's predominantly inattentive, predominantly hyperactive, impulsive, or combined. And when you have ADHD, it's associated with lower than normal activity in your prefrontal cortex, so your frontal lobe, your basal ganglia, and also individuals with ADHD tend to have abnormal levels of dopamine, serotonin, and norepinephrine. Some people do outgrow the symptoms of ADHD. Typically, when we see people outgrow some of the symptoms, it's more of the hyperactivity, whereas the inattention issues tend to persist into adulthood for a lot of people that have the disorder. So this might look like having a hard time with attention, completing tasks, house chores and responsibilities, prioritizing things, and hyperactivity in adulthood typically looks like restlessness, fidgeting, and talking a lot or struggling to relax. So in terms of sex lives of people with ADHD, about 40 to 50% of people with ADHD struggle with sex. Something important to keep in mind with ADHD is a lot of people have an issue when it comes to their dopamine receptors, and they tend to get in a flow with certain tasks. So they might be very focused on a certain task that's interesting to them, and then they might put other things to the side and not prioritize them as much, and that could be related to sex. Sex is a task, and I know it's not sexy to talk about it that way, but in terms of ADHD, it can be put to the side and not as much of an interest with someone with ADHD, or it could be the opposite. Someone could be very focused on sex in a certain period of their life, which might cause some issues in terms of a desire discrepancy with the partner. In general, when it comes to ADHD in relationships, a lot of the time during a new relationship, someone might be very interested in sex, especially because the newness of the honeymoon phase. It's like, ooh, you're very focused on that. There's different hormones that get released during the honeymoon phase, which is about the first 6 months of a relationship. So someone with ADHD might be very focused on smegs and intimacy and whatnot, and then after the honeymoon phase ends, they might be less focused on that, which might cause their partner to have some insecurities and maybe feel unwanted. So there's a lot of challenges that can come up with ADHD, but I want to focus on 3 because I like the number 3. So in terms of considerations, number 1, it's very common that people with ADHD get distracted, and this can really impact someone's sex life. So if you get distracted when you have ADHD, let's say there's an interruption in the bedroom, it might be harder for individuals with ADHD to actually refocus and be in the moment. And as I've talked about many times on many of my videos, it is difficult to enjoy sex and pleasure when you're not in the moment. So for example, you might be getting hot and heavy, doing foreplay, in the midst of your heated sexual experience, and then all of a sudden the dog jumps on the bed. You make eye contact with your cat, and then all of a sudden you can't focus. Let's say you want to stop and you don't feel comfortable and you've kind of lost your arousal in that moment. This might lead to some issues such as insecurities with your partner, feeling disconnected, feeling unwanted, when really that isn't what's going on. It's more so you have a hard time staying in the moment because you got distracted. It's important to keep in mind that vulnerability factors might make this worse for someone with ADHD. For example, let's say you're sleep deprived and you didn't get enough sleep, then you might be more susceptible and vulnerable to certain distractions. So it's important to keep in mind that if you are sleep deprived in general, this might actually make those symptoms worse. Therefore, a distractor can actually really get you off track in those moments. And there can be a lot of things that distract you besides just pets. It could be the lights, it could be a sound. I'm going to get into sensory issues in a bit, but just keeping that in mind. And it could be harder to have a big O when you get distracted. Not that big O's are the end goal. I'm going to talk about that too. But treated ADHD can improve your sex life in those ways, and a lot of that can be related to the inattention issues. Number 2, feeling bored. A lot of people with ADHD, they might actually find that they feel bored with their sex life because sex might feel repetitive over time. They might have issues getting or staying aroused. So in this case, a lot of the time it can be really helpful to try new positions or incorporate new things into your sex life. For some people, it could be adding tactile sensations, costumes, lingerie, maybe some kink related things, finding certain devices that make you feel more aroused, sex toy, vibrator, etc., etc. Just spicing it up and trying something new, which honestly is healthy for everybody. But when it comes to feeling like sex is boring, that might be more relevant to someone with ADHD. So really finding ways to spice things up, adding new sensations safely, of course, doing research on that, using wax, using arousing massage oil, using different types of lubes. By the way, you might really like a certain sex act, like you might be really, really into doggy style, and then all of a sudden decide that you don't like it. And that's that's typical with pretty much anybody. This might be more prevalent with someone that has ADHD, even though it's something that humans experience in general. What can become problematic in these situations is the way that you communicate it with your partner. So instead of saying, don't do that, I don't like that, having a conversation before you're having sex outside of the bedroom and just letting them know that, yeah, sometimes my interests do change and it's not you, it's more so a change of interest. So it doesn't mean that because I like incorporating ice cubes in the bedroom, it doesn't mean that I'm going to like it every time. So can we just check in? Something that I learned in a Sexual Health Alliance seminar, which I really like and I've been recommending to my sex therapy clients, is using red light, green light dialogue. So green light is yes, let's do this, yes. Yellow is like, I don't know, we can try this, I'm not really sure. And red light is, oh, I'm not comfortable with that. So having a predetermined code language can help somebody feel not as rejected in the moment, because you're not rejecting them, you're rejecting the use of ice cubes again, because some people are into ice play, which can be totally hot. But if you like it one day and then you don't want to do it the next, totally okay. One that really comes to mind a lot when it comes to these types of examples is nipple play. So some people might really like their nip-nips played with, but that doesn't mean they want their nip-nips played with all the time. So just keep that in mind. Some people might like to cuddle after sex. They like that aftercare, but other people might not feel like I'm in the mood to do that. And that kind of leads into the sensory issues. So it might depend on the temperature of the room or their mood or sensory issues. So number 3, when it comes to ADHD, a lot of individuals really struggle with sensory issues. And a lot of the time that's related to taste and smell. So for example, if someone uses a perfume or a cologne or massage oil, it might actually bring someone out of the moment because they get distracted by the sensory overload of that smell. It could also be sound, so it could be like a loud AC, a fan, a certain noise that the fan makes, something that the neighbor is doing, right? The dog starts barking, and then that individual gets very distracted, and then therefore sensory overload gets them out of the mood. So just knowing these things, whether you have ADHD, kind of to cope ahead for them, or if you're a partner of someone with ADHD, it might be helpful to keep in mind or have a conversation about that. Like, is it okay if we have the TV on in the background? Do you like certain kinds of music? And it's okay if they do one day and not the other day, like I said. And in general, communication about how you like to be kissed and massaged and touched in general can be really helpful. Something that's really important to keep in mind is, in general with sex, especially with someone who has neurodivergence, you don't want to focus so much on the goal or the outcome of being an orgasm, right? The end goal. I like to think about the appetizer entree analogy that was introduced by Dr. Steven Snyder in one of the seminars I went to. You don't want to be focused on the entree while you're enjoying your appetizer. So the appetizer can be foreplay, the kissing, the touching, all of those things. You don't want to be focused so much on, I need to have an orgasm, because the more that you put pressure on it, the harder it actually is to achieve that big O. If that's even your goal, if you want to, right? So if you really want the O, it's even more important not to focus on it. But in the moment, what's leading up to that can be the best part. I like to say it like the foreplay is the core play. And I think Shamboody said that before, but I really like that. So people with ADHD, they might have a hard time with mindfulness. So it's important to focus on being in the moment, maybe do some deep breathing, like a 5-7-eat method. And people with ADHD might have a really hard time climaxing, especially if they focus so much on it or if they feel expected to have an orgasm. Something with sexual communication that I think is underrated is letting people know that they're doing a good job, like letting them know that, ooh, I really like this. Or if you're the one giving the pleasure, letting them know that you like how they taste and you're really enjoying that, because a lot of people really get in their head when they're getting head. So letting them know that you enjoy giving them that pleasure can be really healthy, and I want to normalize that. And take your time with the foreplay. Don't rush through it. Patience is really effective when it comes to the bedroom, and consent is non-negotiable. So like I talked about before, making sure that somebody's still into something, which I'm sounding repetitive at this point, but yes, people with ADHD might like something one day and not the next day. So just because they consented to it a few days ago doesn't mean it's okay right now. So practice opening up to your partner, especially if you have sensory issues. You don't want to make them feel insecure about a certain smell or whatnot, but if they know that it's a sensory issue and it's not related to them specifically, then that can be really healthy. And how can I make the environment more comfortable so that we're both feeling more comfortable in the bedroom? And knowing this might change. Music might be helpful one day, not helpful in a different day. By the way, ADHD is commonly comorbid with other disorders. For example, a history of trauma, anxiety, self-esteem issues, body image concerns. If left untreated and undiagnosed, this can lead to a lot of relational issues And this can really impact the way that someone sees themselves, as well as their ability to form and maintain healthy relationships. It's really important to consider that talking to a therapist about ADHD can be really helpful. It could also be helpful to talk to a psychiatrist about medication. I'm not a psychiatrist, so I won't get into that too much. There are other treatments for ADHD, such as biofeedback, etc. But in terms of the talking to a doctor about medication, you want to really make sure to keep in mind that there are a lot of side effects to certain medications. So keep that in mind and talk about it with your doctor. So yeah, talk to a therapist, maybe a sex therapist too. Coping ahead for improved communication with your partner, which does take practice. Like I said, if you can find a individual or a couples therapist that specializes in sex therapy, then even better. You can look at the AASECT website to see which therapists are in your area. You can also use Psychology Today to find therapists. If you live in Pennsylvania, I do see clients in Pennsylvania. Given that we're talking about ways to improve your communication with your partner, I want to take a moment to tell you about a program called Our Ritual. So Our Ritual is a really amazing website and app. The way that it works is it will match you with a professional to help you with your relationship issues, whether it is certain conflict, building trust, improving communication in general. It can be really helpful to have somebody to guide you step by step. So the way it works is they match you and your partner with a relationship expert. These are fully licensed professionals consisting of psychologists, marriage and family therapists, and clinical social workers, and they all use scientifically backed methods. And so this might include psychodynamic therapy, cognitive behavioral therapy, narrative therapy, solution-focused, Gottman method, or emotion-focused therapy. This could be helpful for individuals, couples, parents, and pretty much anybody, very diverse. So regardless of where you might be on the LGBTQ+ spectrum. And their chief clinical officer is actually none other than Dr. Orna Guralnik, and you may have seen her on Showtime's Couples Therapy. I know I've watched it, really interesting. So yeah, you pay a monthly fee and you get 24/7 access to Our Ritual. For more information and to check out the link, it is in the description of this video. So yeah, check that out. Our Ritual might be really helpful in guiding you and your partner through difficult times in conflict. I hope you enjoyed this video on ADHD and sex, and happy to make more videos similar to this. Let me know if there's anything that resonated with you in this video, and thank you so much for watching. If you like these types of videos where I go into deep dives on psychology, relationships, and sex and pleasure, then make sure to hit that like, hit that subscribe button. I'm going to be posting weekly videos again. I'm going to be prioritizing it because it's very important to me to get this knowledge out there. And thank you so much for watching. As I was filming my outro, my camera died and I don't feel like waiting for it to charge. So everyone, please make pleasurable decisions and decisions because you deserve it. And thank you so much for watching. I will see you next time.